Alright, so the first test I'm going to be performing today is going to be the handshake test for medial and lateral epicondylitis. Alright, so you're going to have your patient seating or standing, doesn't really matter because it's a handshake. So, Reed, shake my hand. Now you want them to give a firm handshake and you want to palpate the medial and or lateral epicondyle depending on where their pain is. So if it's on the anterior side, you want to palpate the medial epicondyle, lateral side, or dorsal side, lateral epicondyle. And during this, they'll feel pain up on that condyle because that's where those muscles attach. A positive sign is pain. Alright, so the next test that I'm going to be performing is the resistance test for lateral epicondylitis. For this test, it's easiest to have your patient sitting on a stool, arm on the table, wrist in neutral, not an extension or flexion. Now Reed, can you make a kind of like a claw with your fingers? You're going to focus on the third phalange, and this is going to be testing for lateral epicondylitis because, hold it Reed, when you push down, let me stabilize first. When you push down, the muscle attaches on the lateral epicondyle, so when you push down, he'll feel pain in that area. You can also palpate when you do this, I guess. And a positive sign for this is going to be pain. Alright, the next test I'm going to be performing is the Cosen's test for lateral and medial epicondylitis. It's two separate tests, but I'm going to be performing both of them in this video. So the first test is going to be testing for lateral epicondylitis. You want your patient sitting on a stool, arm on the table, and you're going to put them into wrist extension. Reed, hold this for me, alright? I'm going to cup around the wrist so I'm not putting any weight on the muscle, and I'm going to push down. Ready, Reed? Go. If they have lateral epicondylitis, he'll feel pain up on the lateral epicondyle. Now, for medial epicondylitis, you're going to have them just flip their arm over and you're going to put them into wrist flexion. Same thing with stabilizing, cup around the wrist, and you're going to push down. Ready, hold it. 1, 2, 3, 4, 5. And they'll be feeling pain on the medial epicondyle. The next test I'm going to be performing is the passive stretch test, and that's going to be testing for medial and lateral epicondylitis. It's going to be two tests, but I'm going to test them both in this video. So you want your patient lying supine, at least I do. I feel like I get better body mechanics when I do this. I sit on the edge of the table and rest their elbow on my thigh. And then you're going to want to put them into wrist extension, and then you're going to want to force elbow extension. And then you want to put them into more supination. And at the same time, you're going to want to palpate the medial epicondyle. They'll feel pain with this, and that's how you know they'll have medial epicondylitis. But it's only on the epicondyle, it's not if they feel it in their forearm. Next, you can do the lateral epicondylitis test. So you're going to put them into wrist flexion, and then once again you're going to put them into elbow extension and force pronation and palpate the lateral epicondyle. They'll feel pain on the lateral epicondyle, which is a positive sign for lateral epicondylitis.
Next, I will be doing the chairlift test, testing for medial and lateral epicondylitis. With this test, you'll need a stool or heavy chair, something your patient can grip. You have to have their elbow at their side flexed, the hand pronated, and wrist extended. There you go. And then lift the chair with your elbow, like that. If they have pain, they'll have pain on their lateral epicondylitis, and that's positive for lateral epicondylitis. And then for medial epicondylitis, they'll have their hand pronated, the wrist flexed, that, and lift with their elbow. And if they have pain on the medial epicondyle, then it's positive for epicondylitis. Next, we'll be doing elbow, varus, and valgus test. With this test, with the valgus test, you have their arm extended, and you push medially at the elbow, and then at 30 degrees. If they have any pain during full extension or the 30 degrees, they could have a UCL or medial collateral tear. With varus test, come on this side. You have their arm extended at 0, but you push laterally, and then 30 degrees. And if they have pain, they'll have, it could be positive for a lateral collateral or RCL injury. Next, I will be doing the moving valgus test. With this test, you're testing for an LCL or UCL injury of the elbow. You have their arm abducted to 90 and their elbow flexed at 90. And you will be stabilizing and pushing from the posterior side of the arm. You give a vagus force, pushing with the hand here, and then extend their elbow out. And if they have any pain, it's positive for a UCL or LCL injury. Lastly, I'll be doing Tunnell's test. First one, you can test at the ulnar nerve. So you just relax your arm and hold them with your hand at the forearm, and then you can tap at the at the ulnar nerve for at least 30 seconds. If they have any numbness or tingling down their arm into the 4th and 5th fingers, they could have a problem with their ulnar nerve. And then for the median nerve, you just tap anteriorly in the middle of the elbow. Same thing if they have any numbness or tingling down the middle of the hand into the first 3 fingers, they could have a problem with their median nerve.